Welcome dear students. Myself Dr. Surbhi. I am Assistant Professor at the Department of Veterinary Surgery and Radiology in the College of Veterinary and Animal Science, Sardar Vallabhbhai Patel University of Agriculture and Technology, Meerut. So dear students, today we are going to discuss about the role of veterinary surgery in the self-employment of the veterinary graduates. Okay, so as we all know, there has been an increase in animal population in India. As per the latest census, both the population of the dairy animals as well as companion animals is increasing in India day by day. This increase in animal population directly relates to the increase in demand of specialized veterinary care. So there has been an increase in demand of veterinary professionals. In addition, the clients want a specialized veterinary attention for their animals. For example, specialized veterinary nutritionist, veterinary pathologist, veterinary physicians, veterinary gynecologists and likewise veterinary surgeons. So in the today's topic, we are going to discuss a setup of veterinary clinic with special reference to veterinary surgery.
So dear students, the topic of today's discussion is veterinary surgery transforming graduates into self-employed professionals. Let's introduce the topic. After a student graduates, then there are many avenues like he or she can go to government sector, they can go to civil services, academics, they can join courses like RDC, ITBP, or they can go for the private sector. Among the government sector, there are many options like you can go to APEDA, FSSAI, FCI, bank, or the majority of the chunk of the veterinary graduates goes into veterinary officer, also known as veterinary assistant surgeon in some of the states like J&K. Or he or she may pursue further education, and for that they have to do post graduation, which can be done by ICR, or some states are taking a separate entrance exams like UP cadet, and some of the universities are taking their own entrance exam like Duva Sumatra, or they can opt for a degree in the foreign country like by TOEFL or NAVLE. After post graduation, again the students can go to an educational institution after doing NET and PhD in the concerned subject, or they may opt for the private sector. In the private sector, they can have a lot of options. Like in dairy sector, they can go to slaughterhouse, poultry sector, pharma sector, MDA, or they may open a clinic. And this is very important because of the today's topic. Now the thing is how veterinary surgery will help in the self-employment. And the answer of this question is setting up a clinic. And so here lies our topic of discussion. We will discuss the steps to set up a professional veterinary clinic. And there are many steps and they may be overlapping or there may be some other small steps in between also. But these are the major steps which should be followed to set up a professional veterinary clinic. The number one is you should know what is the important of the thing that you are going to do. It is important in any kind of entrepreneurship. Okay, so first of all, you should know what is the important of veterinary surgery in entrepreneurship. Then second step is you have to do market demand analysis to identify the target population. And third is you have to do market demand analysis to identify the niche areas in which the service will be provided. After you decide it, then you have to choose the business model that I will discuss further. Then you have to do preliminary cost benefit analysis. See, this is a very important step. You have to maintain a balance sheet. Okay, you have to see what are the different investment, what are the operating costs, and what revenue you are going to get from it. If this balance sheet isn't positive, only then you can go for the project. Otherwise, if you are thinking that you are going to get the revenue without maintaining this balance sheet, then it is a very problematic thing. So you should maintain a balance sheet before the start of project also. After you have done all these things, there are certain legal compliances which should be maintained. Okay, these are very important because you are working in a service sector. Okay, then you have to market yourselves. Okay, it's very important because in today's era you have to market yourselves and provide services to the clients. After this, an important thing is risk management. So these are the initial steps, and after you have set up a clinic, then again you have to do the cost benefit analysis. If the cost benefit analysis shows a profit, only then the project is sustainable. Okay, so we will discuss these steps one by one. First of all, who have to know the importance of veterinary surgery in entrepreneurship. So for that, you have to go a little back. So in the early stages, as you can say, you have mention of veterinary surgery in Mahabharata also, Sushruta, Nakul, Sahadev. So veterinary surgery has its roots in ancient practices also, but in earlier time, the surgical interventions were very rare and non-specialized. Then came the developing stage in which the veterinary surgery it also developed along with the advancement of human medical knowledge. Techniques improved with the discovery of anesthesia, aseptic techniques and antibiotics. And now we are in the modern era where the veterinary surgery is highly specialized field. There is continuous advances in minimally invasive techniques, advanced imaging techniques like X-ray, USG, CT, MRI, and robotic assisted surgeries. So the present stage is very important from the clinical point. Then there are certain importance of veterinary surgery. Why we have to choose veterinary surgery? See, there is a change in landscape. Earlier, veterinarians were employed only in government or dairy sector. But now, as you know, the dairy sector is very profitable. So, large animal dairy is very profitable, and the dairy owners they ask for specialized veterinary care. Then urbanization and pet ownership has led to an increase in number of companion animals. Second number thing is opportunity for self-employment. When you are self-employed, then you have a greater control over the work, you have flexibility in hours, and you have a choice of specialization. The third thing is rewarding career. There are potential for higher earnings as compared to salary. I'm not saying that this is an absolute thing, but there are chances. Okay, and it also gives you personal satisfaction. And in addition to it, you can contribute to the society. How you can help? You can contribute to the local economy, and you can create job. You have to keep some technicians, and sometimes you have to hire other veterinarians also. So you will be creating jobs. Okay, and then you will be able to provide essential services to underserved areas. Then second step was is to do market demand analysis to identify the target population. So for that, this is a very important step, my dear students, because you should be knowing where you are going to open your clinic. Okay, it may be urban area, rural area, or semi-urban area, and depending on that, your practice will vary. If you are working in an urban area, so you should be clear that the in the urban area, the companion animal practice will be more. Clients are more aware and it will be a very competitive market. Okay. But if you are located in a rural area, then you have to focus on large animal mainly, where there is lower availability of specialized veterinary services. We call them quacks. Okay, they are serving all the large animal practice in the cases of rural areas. So there is a potential market to be tapped here. If you provide emergency surgery, and it will give higher benefits to you. Okay, so this is a very untapped market. Then third one is semi-urban area. So semi-urban area will be having a mix of small and large animal practices, and there is potential for establishing multi-service clinics. So you have to identify the target population to decide the further setup of the clinic. Now, when you have set up the clinic, then you have to identify the niche areas, the which services you are going to provide. So there are lot of services like soft tissue surgery for which we will be requiring general surgical pack. For orthopedic surgery, orthopedic instrumentation is required. If you are going to do ophthalmic surgery, at least basic instruments should be with you. If you are going to do minimal invasive surgery, you have to have endoscope or laparoscope. But these type of surgeries can be done only if budget permits. Okay, and if there is demand. And then if you can go for the emergency surgery, so these are to be done outside the time frame. So you have to identify the niche area, and to identify this type of which type of service you are going to do, you have to collect a preliminary data. So data collection is very important. And one more thing is that you have to identify more than one niche area. You cannot work only on soft tissue surgery or orthopedic surgery because veterinary surgery is not very much specialized till now in India. I'm not talking about abroad. I'm talking about India. So you have to give service in more than one type of area. Then now you have identified the opportunities, you have done market demand analysis and identified the target population, and you have identified the niche areas. Okay, the type of cases we are going to deal more. Okay, now you have to choose the business model. So this type of business, which type of business model that we are going to Work may be solo practitioner, group practice, mobile veterinary unit, or specialized surgical center. So in case of solo practitioner, when you're working alone, there are advantages of autonomy in business, autonomy in decisions, working hours, service offered, but there are certain challenges. Like you will be having the sole responsibility of management, marketing, and most importantly, finance. Okay. Second one is group practice. There are certain advantages like you will be having shared resources, diverse expertise, work-life balance, but there are certain chances because of potential for conflict. So dear friends, the agreements and paperwork should be very clear if you are going into group practice. Okay. Third one is mobile veterinary unit. See, it can be this type of model, mobile veterinary unit. It can be done alone or it can be combined with the type 1 or type 2 of business model. Okay. So, what are the advantages of mobile veterinary unit? There will be convenience for the clients, flexible work location and versatility. You can work for both large animal and small animal. But there are certain challenges, like there are logistical issues. You have to transport the equipment, you have to transport the manpower, and the main problem with mobile veterinary unit is to maintain the sterility. Because the sterilization of the equipment is very important, especially in case of veterinary surgery. Okay. Then the fourth type of business model is specialized surgical center. And the advantages are it can attract referrals from other veterinarians and you can charge more for a specialized surgical care. But there are certain challenges because the investment in machines will be higher here. Again, the marketing has to be focused. It has to be very aggressive, sorry. And then the revenue, because of the less number of cases, there are chances that the revenue will be less. So, my dear friends, among all these models, the model may be revised also. For example, you might have started as a solo practitioner, but you can go for group practice after a certain time. Then you can add mobile veterinary unit in your place. Then you can open a center of specialized surgical center also. So it depends on the time, it depends on the type of cases, and it depends on the type of revenue you are getting. Okay. Then you have to do the preliminary cost benefit analysis in which there are three components: investment, operating cost and revenue. So the cost benefit analysis include that the investment plus cost it should be equal to or more or less than revenue. The revenue should be more, otherwise the project will be a failure. Okay. And the second point is that you have to set a time when you start achieving profitability. For example, you are thinking of opening a clinic. Initially, you have to put some amount of finances in it. You have to buy some machines, you have to buy some instrumentation, you have to locate a place and you have to set up the clinic. But after a certain amount of time, maybe 2 weeks, 2 months, or 6 months, or likewise, you should start getting revenue. Okay, you should start getting profit. Okay, now we will discuss them one by one. First is initial investment. The three important things in investment is a place to work. See, dear students, the place can be rented or purchased and it depends upon your financial capability. Okay. Then you have to buy equipments and instruments. And the third is hiring the staff. Number one is place. So as I have told you, we have to do initial study and you have to identify the target population. Now as you have identified the population earlier, you have to decide you are opening a large animal clinic or small animal clinic or you are opening a multiple type of clinic. So there are 7 places which should be there in your clinic and there are additions also, but this is for the initial startup. Okay, you will be needing an OPD area, you will be needing a surgical area, sterilization area is very important. Then you will be needing a storage area, and if possible, you should have a diagnostic area, owner waiting area, and doctors too. See, all the things are same here, except for these two. You should have a separate OPD area. For small animal, you will be requiring examination tables, and for large animal practice, you will be requiring a larger area. If you are having a restraining preference, then it will be beneficial for you. Then the surgical area in case of small animal clinic will be requiring a small animal operation theatre, okay, with the facilities. And in case of large animal clinic, if you are able to do, you can do it indoor or otherwise you have to do it outdoor. But the area has to be bigger in case of the large animal clinic. Second thing is equipment. Basic examination equipment should be there. Basic wound dressing instrumentation is required. General surgical bag is required, and these are separate for large animal and small animal because of the size of the instrumentation. Then basic orthopedic instrumentation is required, and advanced instrumentation can be bought based on the market demand analysis. Third investment, which is very important, is staff, the manpowers. You will be requiring animal handlers for large animal and small animal likewise. You are be required of cleaning staff because they have to clean the premises and they have to clean the instrument, they have to clean the table. So the cleaning staff should be very helpful and also they should be paid nicely. Only then they will work nicely. Then you will be requiring technical staff. You can hire other veterinarians also based upon it. So what are the main characters that these manpower should be having? They should know the basic client handling. In case of the veterinarian, it should be he or she must be having good surgical skills and business acumen is also required. A person with degree of hospital management or account may also be hired by you if you are not able to do the balance sheet things. Then you can hire another person also to manage the accounts. These are the pictures I have taken them from net only. This is a travis for large animal. This is examination table for small animal. This is autoclave. See, this autoclave is very part of the surgical setup because it is a prerequisite. It is essential. Without autoclaving the instrumentation, there are high chances of getting infection from hospital to the patient. Okay, so autoclave is an essential part. You must buy it. Okay, then this is weight of operation table for small animal. This is a picture of portable X-ray machine. If possible, you can buy it because portable is very handy. You can take it from one place to another. Then this is 100 mm X-ray machine. Other X-ray machines are also there, but they are very costly and they require proper guidelines to be kept. If possible, you are keeping a diagnostic area, then an ultrasound machine is very helpful. But there are certain things which are to be done that you have to get it registered by PCP and NT Act 1994. Then you have to keep the record of all the ultrasound that you are doing. Then you have to keep the machine in one place. So this is very important. And if you are using it in the mobile veterinary van, then you have to take the permission of the competent authority. Otherwise, you cannot move the ultrasound machine. Another thing is that whosoever is going to use the machine, it has to get its name registered. Okay. So after initial cost, there are recurrent costs. They are also known as operating costs. You will be requiring money for hospital supplies, maintenance of buildings and machines, and the salaries of staff. These are some of the example of hospital consumables like syringe, needle, gauze bandage, mask, cap, gloves, thermometer, stethoscope, wound dressing material. Then third thing is revenue that we are going to get now. Okay, earlier you were only spending money. Now you have to get the money. To get the money, there are mainly three things like you can get money from surgical fee, post-operative care of the animals. So you can also offer additional services like diagnostics, vaccination, etc. After you have done preliminary cost benefit analysis, you have to fulfill the legal compliances. Like you have to go for the insurance, the medical insurance of staff, insurance of the clinic, and insurance of the equipment. Then USC machine, as I have already discussed, you have to do PCPNDT registration along with the users. Then in case of X-ray, if you are keeping an X-ray machine, the dimension of the room should be according to the guidelines. There are set clear guidelines available and you have to follow the thickness of the wall, the height of the room, and then there should be boards that pregnant women should not be allowed inside. So all things should be written there. Okay. After legal ethical consideration, you have to market. In the market, the first step is you have to build a client base. And to build a client base, you have to take care of the marketing strategies. You have to do client education. You have to retain the clients which are available with you. So the marketing strategies are you have to show the online presence. If possible, you create a website of yourself. You have to be present in the social media, and the satisfied customer, satisfied client can give a good online review to. Then you can participate or sponsor some events. You can do educational workshops. You can do collaboration with educational institution, NGOs. You can keep a database of clients. Okay. Then client education is very important. You have to educate the clients if surgical intervention is necessary. Use easy to understand language. Provide detailed aftercare instructions, and you have to tell the importance of preventive care to the client. Then client retention is the third thing. Provide quality care to the animals, use client feedback, schedule routine follow up, give personalized services, maintain high standards of cleanliness and professionalism. So you have to add new clients and retain the earlier. With the help of these marketing strategies, you can keep the good client base. Another thing is technology and innovation. See, this is very also important in marketing because because of the current time. So you can use advanced surgical techniques like laser, endoscopy, implants, interlocking nail, plating, and many more are there. And but these are optional depending upon the type of cases coming to you, depending on the revenue, depending on the finances. You can go for the advanced surgical techniques. Then the other thing is telemedicine. You can do remote consultation by telemedicine on phone, on WhatsApp. You can do pre-surgical evaluations, follow-up care, client education. It will give a wider reach to you, and it will save the visits of the doctor and of the clients also. And for the future planning, always be ready for the changes according to the market. Keep on learning new surgical skills, upgrade your knowledge regularly, and be ready for the innovation. Another thing is risk management. So the risk management that are mainly important in case of a veterinary clinic setup is to reduce the financial risk. And to reduce the financial risk, important step is to ensure the equipment. Okay, ensure the clinic. Another thing is there is a lot of competition nowadays, and you have to manage the client. So you have to give diversification of services, and continuous professional development has to be there so that you can reduce the risk. Now you have done all the steps up to the number 8. You have done market demand analysis, chosen the business model, done preliminary cost benefit analysis, fulfilled legal compliances, you have done marketing, you have managed the risk also. Now you will be doing actual risk benefit, you will be doing actual cost benefit analysis, friends. So it means you have to maintain a balance. The initial investment plus the operating cost must be less and revenue must be more to achieve the profitability. Okay. So revenue must be more only then the project is running successfully. And I wish all the students who are listening to this lecture and who are planning to open a clinic, and I am wishing all of them all the best, and their revenue be more than their investment and operating cost. Thank you so much.
So dear students, this was in brief about the topic of setup of a veterinary clinic. I hope this lecture will be very useful to you, and it will be helpful to all the veterinary graduates who are trying to open a veterinary clinic in India. Jai Hind.